My name is Leah Lanou, and today I am presenting on Turner syndrome. This is a genetic disorder that affects your sex chromosome. It affects only females because females typically have an XX chromosome and males have the XY chromosome. And in Turner syndrome, it only affects females because one of the X chromosomes are going to be either missing or partially missing. And then in my presentation, I will continue to explain what Turner syndrome is, the history of it, symptoms, what causes it, and preventative factors that can be taken. So before birth, there are some signs and symptoms that can be noticed while the fetus is still in utero. These symptoms can include a large fluid collection on the back of the neck, heart abnormalities, and abnormal kidneys. And at birth or infancy, so this will be right when the baby is born or in the first few months of the baby being born, it'll be a wide or web-like neck, low set ears, broad chest with widely spaced nipples, high narrow roof of mouth. That's going to be like the palate of your mouth, your hard palate. Arms that turn outward at the elbows, fingernails and toenails that are narrow and turn upward, so like a curve in your nails, in your nail beds. Swelling of the hands and feet, smaller than average height at birth, and then this height is going to be a main symptom that follows throughout adulthood and stuff. Slowed growth, that is also another symptom that'll be throughout life. Cardiac defects, that is also another one that'll be throughout life. A low hairline, receding or small lower jaw, so that's going to be like your mandible right here, and short fingers and toes. And then my picture right here is of a baby that is illustrated to look like a baby that would be with Turner syndrome. You can see that it has the low posterior hairline. That's going to be I don't know if you can see my mouse, but if you look at the back of the head, you'll see the hairline exceeds way down there. You can notice the baby has the webbed neck with extra skin. You can kind of see the wide set nipples. Discolored spots on skin is also another symptom. Swollen hands and the swollen feet. You really can't see the hands or feet in the picture, but whenever I upload my PowerPoint on Moodle, you'll be able to notice if you look at the picture. Next, there are also signs and symptoms you'll see in childhood, teens, and adulthood. This is going to be slowed growth, no growth spurts at expected times. So, every year children grow and stuff. So the females that will have Turner syndrome will not grow like other females or males their age. Adult height significantly less than expected for a female member of the family. So if females in your family are usually 5'8", 5'9", 5'10", 6 foot maybe, these females will not grow to be that tall because of their missing X chromosome. They will typically be around like 4'11", 5 foot. Actually, the tallest height I seen doing my research was 5'3" in a female, and that was doing therapy with the growth hormone therapy, which I will explain later on. There will be a failure to begin sexual changes expected during puberty, sexual development that stalls during teenage years, early end to menstrual cycles not due to pregnancy, and the inability to conceive a child without fertility treatment, if they're even able to conceive a child. There are going to be like ovarian problems because of the missing X chromosome. In the picture, you can definitely see the jaw, the low hairline, the webbed neck. And then in the other picture, you can definitely see the webbed neck and the low jaw more from the two different profile images. And then you can see her shoulders are kind of uneven. And then, so that's going to be what Turner syndrome typically looks like in a teenager or like young adult woman. So now I'll move on to the history of Turner syndrome. It was founded by an endocrinologist, I'm not sure if I'm saying that right, named Dr. Henry Turner in 1893. He was working at a clinic in Oklahoma, at a hospital in Oklahoma, And while he was working there, he was doing endocrine studies and stuff, and he noticed that 7 young women at the clinic he was working at was starting to show signs of what we know as Turner syndrome. So the short height, the web neck, swollen hands, fingers, all that stuff that I discussed before. He noticed that these 7 young women displayed that. So he decided to look further into it. He started doing x-rays, genetic testing, and then that's whenever he realized that the X chromosome was missing. And he named this syndrome after himself, Turner syndrome. This picture right here is going to be a picture of Dr. Henry Turner. And then this is going to be, I think it's called a karyotype of all your chromosomes. And then you'll see, if you can see it, I think it might be a little cut off. But like I said, when I upload my PowerPoint on Moodle, you can see the full picture, but you'll see that the second X chromosome is missing, and that's what it looks like in females who do have Turner syndrome. So these are some of the treatment options available for those who do have Turner syndrome. The 2 I seen were going to be growth hormone therapy and then estrogen therapy. With the growth hormone therapy, you want to try to do it as soon as possible. So early intervention will give the best result, and that is typically for every single disorder, syndrome, whatever, that you want to try to do therapy as soon as possible, because as soon as you start therapy, that's whenever you're going to start seeing results sooner and better results. So with the growth hormone therapy, it's going to be a daily injection of growth hormone that's put into the body, and it's intended to increase height and your bone growth. It'll like I said, women who have Turner syndrome are typically 4'11", 5 foot, 5'1", maybe even shorter. And then the women that I did see who had growth hormone, the tallest I seen was maybe like 5'3", and that is typically short for a woman. I'm 5'8", so 5'3" is very short to me. But with your growth hormone therapy, it's usually stopped when the female reaches adolescence age, because, everybody stops growing at some point. So if you keep putting that in, then you'll just basically won't stop growing. And then there's estrogen therapy. It starts when a female is around 11 years of age, and that's going to be usually when a woman starts to go through puberty. And it's going to help the development of the breast and uterus, and it helps the female to look more feminine. And then this can continue being given until menopause is reached. So usually whenever a woman is probably like around in her 40s or 50s. Dr. Turner, who I had mentioned in the previous slide, he did do estrogen therapy with some of the females that he worked with at his clinic in 1893. So here are some preventative factors. Well, there really isn't any preventative factors. Turner syndrome is entirely random, so there aren't really any preventative factors to be taken, because this is just a complication with the chromosome. There really is anything you can do with it to prevent it. It's not hereditary, so it can't be passed down from your biological mother or father. So if you as a woman have it, and then you were able to give birth to a child, your child might have it randomly, but it's not going to be because the mother has it. It could be caused by complications with the sperm or the egg, because, mother gives down an X chromosome and the father gives down either X or Y, so it could be caused by complications with either or the sperm or the egg, or it could be lost prenatally while the baby is still forming in the womb. And then attached, I put a picture of the Turner Syndrome Foundation. There are support groups online and a lot of stuff. I looked at the Facebook page for Turner Syndrome Foundation for women who suffer from Turner Syndrome or caretakers of children who have Turner Syndrome, for them to connect and, console with each other. And these are going to be all of my references that I have listed for my research. So thank you guys so much for listening, and I hope I was able to educate y'all on this topic.